नमस्कार दोस्तों, आप देख सकते हैं कि मैं आपको लेके आया हूँ CNS कायरोप्रैक्टर एंड स्पोर्ट्स पे। यहाँ पे हम मिलने वाले हैं डॉक्टर सैंडी बंसल से। अब आप पूछेंगे कि हम यहाँ क्या कर रहे हैं। मैं यहाँ आपको इसलिए लेके आया हूँ क्योंकि मैं जानता हूँ कि बहुत सारे हमारे दोस्त हैं, हमारे व्यूअर्स हैं जिन्हें बैक एक है या फिर उन्हें हेड एक है या लोअर बैक में पेन है या नी पेन है या कोई एक्सीडेंटल इंजरी है। तो उन सब का इलाज करवाने के लिए मैं आपको लेके आया हूँ डॉक्टर सैंडी के पास। So Sandy, see, Jesse is doing all these movements and he's assessing with his hands.
Yes. It's like a jigsaw.
Okay.
There's lots of little pieces of information that we put together. So he's assessing the quality of movement, the amount of movement, the muscle tightness,
Yeah.
and in his mind he's putting together a picture of what needs to be fixed, what's working, what's not working,
Okay.
and that's what he'll come up with an assessment of what needs to be fixed.
Okay. So these all movements, they have their own.
He's assessing segment by segment. Because the spine is made up of a whole lot of segments, each one needs to be assessed individually. You can't just look at the whole thing, it needs to be assessed individually.
Okay. So normally if you do a process like this, how long it takes?
The assessment it's individual to a patient. Some patients take a lot longer because of the complexity of their problems. Some patients, once they've been a few times, you know what you need to be looking for, so it's a lot quicker. But it's varied from patient to patient.
And raise that left leg for me. Good, and down. And raise the right leg. And down. Thank you.
He's looked at the two big main joints of the pelvis, the sacroiliac joints, and he's been looking at how they've been moving in relation to each other.
What is a procedure to treat the patient? Like how you do it? What do you do?
Based on the information that Jesse gets from his assessment, he'll make a decision on what to do, how to do it, and what's the safest and most comfortable way for a patient. Today, Jesse's chosen to use an activator. There's over 500 different techniques. It is probably one of the most well-researched tools that we have as chiropractors. Obviously, for different people, there's different ways of adjusting things. Nathal, because he's slightly older and there will be some degeneration in his joints, that's a different scenario from a 22-year-old rugby player.
So with this one, what do you do? Like you put pressure on certain points? Or
The
what?
activator works in several different ways. One's to physically actually move a bone into a different position. The other thing that the activator does, it's the amplitude that it fires at overloads the neural system. It's very similar to rebooting a computer. When your computer hangs, you reboot it. What the activator does is it resets the neural system. The brain has to start all over again, and it resets it to a normal pattern.
Okay. So how long Nathan has this problem?
Nathal's had this problem for about a month now before he came to see us. He's seen his doctor, he's been referred through to us, and we've been working with it. We've had good results with Nathal. Every case is different, obviously. But Nathal's noticed some significant changes in terms of the pain and the tingling down through the arms.
I come with my problem, and I come to see Dr. Sandy, and he treated me quite a few treatment, and I'm feeling much better. Thank you, Sandy.
Injuries are very complex for patients, whether it's back pain, headache, shoulder problems, knee problems. So what we've organised for the viewers of Dreams Productions is a free assessment to see how we can help you.
Thank you very much, Sandy. It was a pleasure.
My pleasure, Rishi.
सो व्यूअर्स, आप लोग को मैं बताना चाहूँगा क्योंकि आपकी सेवा के लिए हम लोग यहाँ पे हाजिर हैं। हम लोग, अगर आपको कोई भी प्रॉब्लम है, आपका हेडेक है, बैक इंजरीज है, बैक प्रॉब्लम है, या नी में दर्द है, या कोई एक्सीडेंट इंजरीज है, आप सबका इलाज यहाँ पे हो सकता है। और डॉक्टर सैंडी बंसल इज़ रियली कूल एंड ही विल हेल्प यू आउट। दूसरी बात, सिर्फ आप लोगों के लिए, यानी कि ड्रीम्स प्रोडक्शन के व्यूअर्स के लिए हम लोगों ने पूरी जो पहली असेसमेंट है वो फ्री करवा दी है। तो आप यहाँ पे आइए, आपको एक पैसा भी नहीं देना पड़ेगा। आप यहाँ पे आके अपना ट्रीटमेंट करा सकते हैं। बस सिर्फ शर्त यही है, यू हैव टू कम हियर एंड मेंशन अबाउट ड्रीम्स प्रोडक्शन। तब तक के लिए, ciao for now.